Good morning, everyone. Thank you very much for joining me on the Toolbox Talk today on manual handling. So what is manual handling? Well, it's an activity that involves anything from lifting, lowering, pushing, pulling, carrying, moving loads by hand or by body force. It's important because injuries are one of the most common causes of workplace accidents in the UK. Manual handling injuries include back injuries, muscle strains, shoulder injuries, hernias that can lead to long-term musculoskeletal disorders. And sudden injuries can occur through incorrect lifting, or it could be gradually build up through repetitive strain. So what's required by health and safety legislation? Well, under the manual handling regs, employers must avoid hazardous manual handling wherever possible. They must assess the risk of injury to the workers and reduce the risk as far as reasonably practical. So by doing this, you must follow safe systems of work, use equipment provided, and report hazards and near misses or injuries. So what are the common causes of injury? They can be lifting loads that are too heavy. They can be twisting whilst lifting, overreaching or overstretching, maintaining poor posture, lots of repetitive movements, rushing, not planning, and not using appropriate manual handling aids. So you'll hear from most assessments the word TILE risk assessment. Well, TILE is an overall evaluation of the manual handling in terms of looking at the task, individual, load and environment to give that overall overarching, make sure that you've covered everything. So when you look at the task, and you'll see from a manual handling assessment form, you'll see a checklist, a tick box with lots of pictorials to look at. So you'll be able to say, well, is it repetitive? Does it involve twisting or bending? Can it be avoided? In the individual, you're considering, are they physically capable? Are they trained and competent? Do they have any existing conditions or health concerns that you need to worry about? The load, is it too heavy? Is it unbulky? Is it unwild, awkward, odd shapes, etc.? And is the weight evenly distributed? And then when you look at the environment, well, planning the route. Is there enough space for where you're going? Is there stairs, slippery environments, obstacles along the way, etc.? So alongside the manual handling risk assessment, there's also two health and safety executive tools available on their website to use. And the HSC are very much wanting you to use these tools as part of the evaluation process to make sure that you capture everything. So the first one is called the MAC tool, and that's the manual assessment charts. So they've got various scenarios looking at load, weight, way you're actual lifting, twisting, postural, grip, etc. And you'll actually score the process of what you're doing on the task to try and identify which band it fits in. And each banding has a color code from green to red to purple. And obviously you're trying to get everything in the green, amber type scenarios. If it becomes red or purple, then you need to be definitely looking at what you're doing and seeing if you can change the process. The other tool is the RAP tool. That's the risk assessment for pushing and pulling. And again, that will look at what you're doing, the forces involved, the posture, the distances and everything else to help evaluate that process. So we go on to manual handling and safe lifting techniques. Well, traditionally, you'll always look at the lifting boxes and the positioning. Appreciate that not all lifting is as straightforward as that, but the general principles apply. So first of all, you need to plan the lift, know where you're going, make sure the route's clear of obstacles. You need to position your feet at shoulder width apart, one foot slightly forward. Make sure that you bend your knees, keep your back in its natural curve and don't bend at the waist. When lifting, make sure that you keep the load as close to you as possible. Hold it around the waist height if you can and avoid reaching away from the body. When you're lifting, don't jerk or make sudden movements. Use your leg muscles as well as part of the lift. Avoid trying to twist and turn with your feet. If you do need to turn, then turn with your feet and not with your back. And when you do place the load down, place it down carefully. Don't bend your knees. Bend your knees again. Don't suddenly put all the force onto your back. Of course, the major thing to do, if you can, is to avoid the manual handling wherever possible. So there's other mechanical means that you could use, such as pallet trucks, sack trucks, trolleys, hoists, conveyor systems. The whole work environment could be planned to prevent lifting wherever you can. Now, the THSP does provide suggested guidance, and you've probably all seen the diagram of the male and female and different weights at different positions and distances out. Generally speaking, men can lift 25 kilograms, women approximately 16 kilograms, but it does very much depend on the physical capabilities of the individuals and their health and exactly where you're lifting. If it's lower to the ground or higher up, then those lift weights reduce significantly. So general good practice reminders: make sure you plan the lift beforehand, keep the load as close as possible, use your legs and avoid using your back, don't twist, use mechanical aids where possible, ask for help. Shared lifting is better than overloading one individual, and make sure that where there is repetitive lifting involved, that there's sufficient rest periods in between. So as an organisation now going forward, trying to assess what manual handling tasks are carried out daily. Try and focus on those at the highest risk. Look at whether or not you can use mechanical means, and also look at any accident history and near misses that help inform that process. Just remember, back injuries can last a lifetime. Generally speaking, if it feels unsafe, stop, reassess the task, and make sure that you raise concerns. Thank you very much for joining me today on the Toolbox Talk. Have a good day.